Hi everybody, this is Nicholas Burkhardt. I'm a student at Weinbrenner Theological Seminary in Findlay, Ohio. And for an advocacy project, I chose to conduct some research on panic disorder and agoraphobia. And instead of sitting here and trying to convey you a bunch of information, I instead actually have somebody who suffers from panic disorder and agoraphobia with me. I'm not going to disclose this person's name because they don't wish people to know about it, but I'll be conducting an interview with him and just asking him a series of questions. And hopefully by the end of the interview, you have a little bit of a more of an understanding of just how much this affects people. And should you encounter anybody who suffers from it, you can have a little bit more of an understanding on how to interact with them, on how to accept the things that they are going through, and how to help them cope with it. So to protect the innocent, I am just going to call this person Bob throughout this entire duration, which of course is not his real name. But here we go with the interview. Hi Bob, how you doing?
Good. How about yourself?
I'm doing pretty good. Thank you for joining me tonight. I do appreciate this. It is a privilege knowing you. It is a privilege to be sitting with you and talking to you throughout the duration. To start off, could you please tell everybody just when this all started?
This started, from my remembrance, started at the age of 14. I remember I was sitting in my economics class in school, and out of nowhere, this sense of dread and fear came over me that I could not explain to you. I can't explain to you. I don't know what happened. My heart started racing. My body started shaking. I was sweating. I didn't know what was going on. I honestly thought I was dying. So I, left the classroom, went to the or nurse's office at that moment, and talked to her about it. But that was the first time that I remember it ever happening to me. Uh, Very vivid experience. It was the most terrible experience I've ever had in my life.
Okay, Bob. Thank you for that. This is Lucy, by the way. This is Bob's dog. She's a beautiful dog. Hi, Lou. Say hi, everybody. Bob, how long has this been happening? Since you were 14 years old?
According to my parents, I've been dealing with this since I was a baby. They said that I had restless leg syndrome as a kid. I was very prone to having very bad uh, hallucinations to where I couldn't even recognize my own family members. I do remember those. I used to sleepwalk a lot. I don't know if that has anything to do with it, but the very odd child. But as a kid, I always remember it being fun and joyful. I don't remember anything really bad happening up until the age of 14. So from 14 to now, I'll be 28 this year. I've been dealing with it for a very long time.
Now, how often do these panic attacks that you have occur?
Random, completely random. It can happen at any time, at any moment. It can happen to a point to where they're extremely bad and they last for months on end. They can last for weeks on end. I've had the longest one I've ever had last was about 6 months of just straight no sleep, barely eating. So it's all random, and then I'll be fine for a year or two. Completely fine, completely fine. No panic attacks, no nothing. So to give you something specific, I couldn't say something specific because it's random.
You don't have specific thoughts that run through your head when these occur. You say random. But there's absolutely no thought process that links to it, or is that also random where you might think of something that could possibly trigger it, as opposed to being completely fine and having a good time with, say, friends or family.
In the beginning, no, I could say it was random because the panic attack came out of nowhere. I had never dealt with anything like that before in my entire life. So it was random for that to happen. But because of that panic attack, it started to. The sense of dread started to get the best of me, which started to mess with my thought pattern. So now thoughts were starting to trigger things. Not all the time. Sometimes it was my body just feeling really uneasy, and then a thought would compound on top of that, making things worse.
When did you start attributing your panic attacks to specific places?
Around the age of, I'm going to say 22, I think, would be a good guess for me. What do you mean specific places, though?
Well, the agoraphobia you have, it's I should mention that usually everybody listening, agoraphobia tends to occur during adolescence, which Bob has illustrated that his did occur during adolescence, and it's usually as a psychological attribution to having panic attacks. You start off having them, and having no rationality of why they are occurring, and until you encounter areas where you tend to have them the most, if that does make sense. And so throughout duration, you start to develop a fear of certain places, which is where agoraphobia comes from. Um, the actual word agora is a Greek word agoraphobia. Agora actually means an open assembly, which is why the term has a tendency to only have an association with the fear of crowds. Open assembly, a crowd of people. But agoraphobia is more of a canopy effect. It has an umbrella effect of attributing to places that are unsafe. So Bob started developing this around 22. So from 14 to 22, that is eight years. So it took him a period of about 8 years, give or take a few, to actually start developing the agoraphobia that hinders him from going to certain places. Now, now, can you that when you were 22, can you elaborate on maybe the first place you started having fear of going to?
Fear of going to, or fear of where I was at already? Because I would say fear of going to. I used to go to concerts all the time when I was younger. I'd go to Detroit. I'd go with a bunch of friends. I was fine. If I was in a car though, and the car was packed with people, it was a little harder to do. There was also kind of like the I forget what is that called? Tight closed-in spaces,
He's thinking
claustrophobia.
of claustrophobia. Yeah.
There was that associated with it, being in the car, not being able to move, not having any arm room. But if we were in a big vehicle, I was fine. I was happy. I was good to go. The biggest experience that I had with going somewhere and it really affecting me would have been a concert that I went to in Detroit, where it was like all open. There was a lot of people, and I didn't really want to go in the first place because I was like, man, I don't know what's going on with me. I went anyways, and it was just, I felt sick the whole time. And from then on, I didn't really go to any concerts after that. I think that was about the last big concert that I had gone to because of what was going on. I didn't have any idea what was going on. And so I stopped after that.
So you see, guys, he was fine. He's fine with crowds. He's typically fine with crowds. It's just he happened to have a certain panic attack in a crowded place, which in that moment he just attributed his panic attack to the surroundings. So now something that he used to enjoy doing, used to enjoy going to, he's attributed to something that is unsafe in a way. So he avoids it now. So you can see the slight progression of what is prohibiting him from moving forward to actually going to certain places or to be in certain situations. Now, Bob, when exactly you've already attributed that, you've already stated that when it started. Now, I say agoraphobia and panic disorder. However, Bob did not know that these were actual things, that this was an actual disorder. Bob was ignorant of the facts. He just thought that there was just something off. Now, Bob, why don't you explain when you actually found out what you had?
Well, that's still up for debate until I see my psychiatrist. But what I was told that I deal with, what was my thought on? What was my thought on it when I finally found out?
Yes.
Okay, this is making a little more sense. That was my thought. Oh, okay. Okay, well, it's a panic disorder. Okay, well that makes sense because what I was told with a panic disorder, anything can trigger. It's not merely just a thought. It's not merely this. It's a actual body disorder that can cause me to have the fight or flight out of nowhere for no apparent reason. And so I was like, well, that makes a lot of sense because a lot of what goes on doesn't make sense to me when they do happen. So it started to make sense in my head. Okay, I'm getting closer to what could be wrong.
It could be wrong. Now, what was the rationality of it all from the moments you would have panic attacks, and we love Lucy. The moment you had panic attacks, and how you thought rationally about when they would occur. What was your thought process going on as far as rationality and logic occurring in those moments, and all the way up to how you when you actually decided, well, this makes sense, when you actually found out from a clinical counselor what was going on?
I didn't have a rationality, I guess. My rationality was, I thought, I thought maybe I had too much energy to drink, an energy drink, or too much something in my system that shouldn't have been there, or it was, when you're going through something like that, your rationality almost goes out the window because it's too hard to think, because your mind is like a whirlwind, like a typhoon just blowing everywhere, and it doesn't stop. So for me to sit back and, what was I thinking at that moment that I was having that doesn't happen. And if it does happen for some people that can do that, that's great. But for me, I was never able to get to a spot where, oh, okay, so yeah, as I'm going through it, calm, collected, okay, what's my rational thought behind this? Oh yeah, that makes sense. That never happened to me.
Okay. So as you can see, everybody, in those moments, in those single moments where you are going through some kind of panic attack, you don't think the way that typical people can think when they're calm and collected and can use logical reasoning to come to the conclusion of why and how something is going on in those moments. Your body is rushing, and you are relying on on intuition, more or less. And as far as intuition goes, for Bob here, he's freaking out. All he knows, all his intuition tells him is that something's wrong and there's nothing more. Something's wrong and nothing more. And like he said, he just has a bunch of energy, and that was as far as his reasoning was. Just fight or flight response. A little too much adrenaline going on. He had no idea. He had no idea. And this is the issue with people who are going through it and do not have the knowledge, the possible knowledge to ascertain why and how this is happening to him or her. So that's why it's important that everybody just be a little more educated on the possibilities of something might medically or psychologically be wrong with the person who acts with such behavior that Bob illustrates. Now, Bob, how has this affected you as far as your social settings?
Family?
If you want to go with family first.
Well, you were talking about getting people to understand.
Yes.
And family is one of the hardest, for me, maybe it isn't for certain people. For me, my family was extremely hard-headed when it came to this. My father especially was affecting me, within that. Considering none of us knew what was going on, I had gone to the doctors at the age of 14, and he said I was depressed. So he put me on Zoloft. And it made things 10 times worse.
Now, was this a medical doctor?
Yes, this is my doctor.
A family doctor?
Family doctor.
Now, side note, do not go to a family doctor unless do not let a family doctor diagnose you, and as far as something that's psychologically going on. Family doctors they have a general knowledge, but they don't have the in-depth knowledge of other disorders psychologically, or possibility of physiological disorders that are going on, to where you could take their word absolutely. They would mostly, or they should make a referral of anything. Family doctors should make a referral for either clinical counselors, and if it's something that requires medicine, they could do it directly to a neurologist if something physiologically is going on with you, or to a psychiatrist, excuse me, and possibility clinical psychologists, specifically, if you require any sort of medication for a psychological issue. So don't always take them at their word. There should be a system of referrals that goes on in order to get you the best treatment possible. And that is another thing that you must be aware of when it comes to anything psychologically disabling. So, to continue, Bob, your family doctor, simply stated that you were depressed and put you on Zoloft. Now, what was it like taking Zoloft?
It made my symptoms 10 times worse.
10 times worse.
I remember I had so much energy. I ran around a big block, or about 10 times, and I could have done it 10 more, 20 more times. It just didn't stop. I couldn't sleep at night. My heart was constantly racing. I mean, it was just bad. It was extremely bad. A very negative experience.
Now again, this is due to, well, you could take it either or. This is due to misdiagnosis of what is going on, which the doctor obviously did, and or wrong prescription of medication. So Zoloft was a terrible idea, right? But with certain medications, specifically antidepressants, since he has an anxiety disorder, obviously he should have had an anti-anxiety medication. But as far as antidepressants, Zoloft, there are many other ones. Zoloft was a terrible choice. Now what happened with Zoloft? Did you stop taking it,
immediately stopped
or
taking it.
immediately stop taking it. Immediately stop taking it. Now, after that, what did you tell your parents? After that, did you tell them what Zoloft was doing to you?
Yeah.
Okay. And then did you talk with them on how to, or if you should get off the medication? Where did it go from there?
Did I tell my parents if I should get off the medication?
Yeah.
Yeah, they're the ones who suggested it.
They're the ones who suggested it.
And I completely agreed.
Okay. and did where did your parents want to go from there though? With
They didn't know where to go from there.
they didn't know where to go.
Nope, we
Nope.
didn't have any idea, and we just kind of let it go by the wayside. Because I started to get, I think around that time, I was getting a little better here and there. I mean, I wasn't completely fine, but I was getting better. It was, whatever was in my system, whatever was going on with me at that time, was slowly fading away, and it took around, I will admit, it took around 3 to 5 months for it to completely, kind of run its course, and I felt better again. I thought it was just kind of like a bad dream.
Bad dream. Now, in light of that, explain an episode from minor to detrimental episode.
Minor would be me going to the store right down the road, and then walking out of the store, noticing that the parking lot's empty, kind of get a little freaked out, like, whoa, all right, a little shaky, just a little shaky, but I'm able to talk myself through that one. I can talk myself through those ones. A more serious one would be going to the store, walking out, seeing that the parking lot's empty again, but this time I'm really noticing how empty it is, and I'm really starting to freak out. Not only am I shaking, but I'm kind of moving my head down, kind of jerking a little bit, like everything's going to be okay, everything's going to be okay. I'm really talking to myself at that moment. I'm really trying to tell myself it's going to be all right. I get in my car, and I drive a little too fast so I can get home as quickly as possible. A really bad episode is where I don't leave my house. I'm just too afraid to leave the house. I don't want to leave the bedroom. I don't want to do absolutely anything. Usually at those points I'm sweating. I'm looking for medicine. I'm shaking. I can't hold on to things. I literally lose. It feels like I have vertigo sometimes.
Explain that further.
What?
The vertigo.
Just extremely dizzy. Feeling like everything's moving around me and I can't stop, and I kind of have to sit on the ground or something, or I'm really jerky and I have to move really quick to kind of snap myself, out of it, but it doesn't work. And your thought pattern is on the negative. It's completely on the negative, and you just can't seem to get it off.
Now let me ask you this, and this is very important for all of you guys to hear. His answer to this. Do you think that your thoughts in those moments that you have those detrimental episodes, do you think that your thought process is the main trigger of what's going on?
No.
Okay. Simple answer, no. It just happens, and then you're, psychologically speaking,
For me, what happens is the episode will happen out of nowhere. It wouldn't even be going to the store or anything like that. I could be sitting behind a computer, and out of nowhere, just dread. Like the very first time it happened. I'm taking a test in economics. What could I be thinking of that would have put me in a position to have a heart rate that's abnormal, sweating, shaking, shortness of breath, wanting to run as fast as I can because I don't know what's going on. trying to want to hide under the desk at the same time. Like you want to go somewhere and you also want to sit and hide under something. What kind of thought would cause that if I'm just sitting there taking a test? It doesn't make sense. It just happened. Really awkward. So yeah, during those times, I cannot say that it is a thought that occurs first. More often than not.
So negative thoughts are simply a byproduct.
Yes.
Of what's going on, because
it's what's going on with my body first.
Yes.
And then a thought is provided along with it.
Okay. So you hear that. You hear what's going on.
For me.
For him.
That's how it happens for me.
Now, I'm going to come back to how agoraphobia typically starts. It starts with having some kind of panic going on. Now, is there a possibility that there is some kind of subconscious elements going on? Things that you aren't consciously aware of, some kind of memory that's going on deep down inside, and it's a memory that is triggered somehow, some way by the conscious, and then manifests itself within a panic attack, a panic episode. That's still up for a lot of debate. It's still up in the air. But as far as Bob's concerned, it's not a thought. It's not a thought. It's not something where he sits there and is doing something on his every day-to-day thing, as whether it be eating breakfast or playing a game or watching a movie. It just happens. The episode occurs, and then the negative thoughts come about, trying to attribute what he's feeling, or sorry, excuse me, attribute a rational thought, a thought that fits how he feels. He says negative thoughts, the worst of the worst when something happens. So keep that in mind when you either see somebody or hear about somebody who suffers from this, who really suffers from this. All right, now we're going to move forward. Thank you for that. Talk about how you feel, or what you do, I should say, what you do to possibly cope in any way, shape, or form to cope with what's going on. Now, you personally, and then what maybe other people have tried to instill in you, or even your counselor.
Man, it's so much. There's lists that go on and on of ways that I've been told how to cope, or
give us three.
Cope.
Give us three.
All right. When I didn't know what was going on, during
track of this.
14 to about 22, when I had no idea that I was dealing with panic disorder or anxiety or anything of that sort. It was easier to cope with, to be honest with you, sometimes. But I would usually put a shirt on over my head, or I'd wear a hoodie, and it's like a racehorse. You have blinders. I'd either cover my eyes completely to where I could not see anything, and it was pitch black, and I would just put my head back and I would relax, not say anything, not do anything, and within a matter of moments, sometimes it could take longer, but roughly around a minute or two, it'd be gone, and I would be fine, completely fine. So that's one way that I was able to do that, and I still use that method today because for me it helps. For me, it's a way of just calming down. Okay, everything's gonna be all right. The next way that I've heard, I tried it out and it didn't really. It did do an awful lot for me. Maybe I should try it more. But the breathing technique, you breathe in for 4 seconds, hold it for 4 seconds, breathe out for 4 seconds, breathe, controlled breathing. That's a technique that I've tried, that I've used. It didn't really do anything, nothing at all. The last technique that I use to I guess you could say, calm myself down, or is to have something with me. This is a really weird. This is really weird, but I enjoy having something heavy around. It's almost like a security for me. Like if I have a giant duffel bag that's really heavy and I set it on top of myself, or if I'm just carrying something, or I go to the store and I'm pushing a cart because I have myself grounded on something. If you guys could understand that, because I'm doing something, and I have something in my hands. That's extremely helpful for some reason, and I have no idea why. I have no idea why. And I'll tell you, I've gone to the store and I go to put the cart away, and right when I put the cart away, and I have to make that walk back to my car, even my car is only 10 seconds away, I want to grab the cart and throw it in my car with me because it comes back for a split second, for that split second. But then I get to the car and I'm driving and everything's fine. So that would be another way for me to cope with what's going on.
Okay.
I could say another, putting in headphones and listening to music has always helped me. That was a really big one for me. But out of all that, yeah. But I've heard a lot of ways to cope and try things, and I've done most of them, and so it works for some people. It just didn't work for me.
Okay. Exercise. Does exercise help you at all?
Of course it does. Help me.
Have you ever tried exercising when you do have an episode?
No.
Never when you have an episode. What happens?
Because the episode. If the no, because usually the episodes are too strong.
Okay.
So I usually have to wait. There were a couple times that we had gone to the gym, but I had to take an Ativan before we started working out, so I was having a panic attack. But the Ativan at that point mellowed me out, and I was able to work out. So technically, I wasn't working out while panicky. I was already calm.
And well, you mentioned the word Ativan, so Bob, could you explain what Ativan is?
It's the greatest thing known to mankind. No, I'm just joking. Ativan, that I know of, just helps. It helps me that when my heart starts to want to get out of control, and my mind wants to start to race, it just calms me down. That's really what it does. It slows down my heart rate, and it just mellows me out. It drugs me up pretty much, and it's something that's helped me tremendously. But I will say that I was extremely afraid to use it in the very beginning because they say it's addictive. They say, if we put it on you for so long, we'll take it away. But I've never had the addictiveness to it. But it has worked for me really well. So far, the only thing that has.
Ativan, everybody. Simply slows down your heart rate. People can use it for more than just simple anxiety. Tachycardia patients sometimes. Tachycardia is just rapid heartbeat. You can also use it. You talked a little about what your family has done in the beginning. Now, once you understood, actually, I should ask that. How many years or how long has it been since you actually known about your diagnosis?
Actually, since I started seeing my therapist, to be honest with you. Not even my doctor diagnosed me with a panic disorder, but she just said I was depressed too, and I had anxiety, and I was like, you don't get it either. But not until I saw the therapist, so that would have been at the end of December. So last year, did I ever find out what a panic disorder was called.
Which brings me to this. brings me to this. Bob has been suffering from this. How old are you, Bob?
Gonna be 28.
Bob is going to be 28. And Bob has been dealing with this since he was 14. 14 years old. That is 14 years. 14 years. The agoraphobia sounds like it set in when he was 22. So he's been dealing with the agoraphobia for about 6-ish years. About 6-ish years. But the panic aspect of it that triggered the whole thing about 14 years. So about half his life he's been dealing with this, and he's just discovering now, and that is why it is so important that the population be educated on this particular issue. 17% of the United States population gets diagnosed. Now that's not quite. It's not quite 20% of the population, which is what everybody would like it to be. But that's a significant amount of people that deal with this, and these are just the diagnosed people. So the statistics on that could be even greater. Most likely are even greater with people who don't know. It's easy to attribute a medical condition, as far as the population goes, with something like cancer. Cancer is abound, but sometimes I want to say metaphorically, the little people get left behind, particularly people with disorders like Bob over here, who don't get the understanding that they need. And we're going to go a little further now that I mentioned that to you, just how much people don't understand. Even the people closest to him don't understand. He's going to divulge that a little bit further. Now, right now, Bob, how has your family, your entire family, reacted to your condition, and have they made any progress?
Right now, I think they've made a little progress. My father, out of all of them, has made the most progress, and is the most understanding of what's going on, surprisingly. But the rest of my family members still struggle with the thought that a couple of my family members have dealt with anxiety. I've dealt with anxiety. I know exactly how it is. Why can he do this, but he can't do that? So there's still a lot of misunderstanding on their part because they don't want to look it up. They don't bother to look it up. They don't. It doesn't seem like they really care to look it up. So,
if you could sum it up in one phrase, what's their reaction to your condition?
I still think they think I'm lying.
You think you're lying?
They think it's fake.
Would they say it's just something you've conjured up?
Yeah.
In your head.
Yeah.
More or less.
Yeah.
Now you'll hear that phrase a lot. As a side note, you'll hear that phrase a lot. It's all in your head. It is a manifestation of your thoughts. A manifestation of your thoughts that you've created in order to deal with something. And it's a simple act of will to alleviate yourself from said disorder. So that's what his family is like. Most of his family, but his father is trying to help him, help the family understand. Right now, how does that make you feel?
I wish they were more understanding, but I don't care.
You don't care. Now, did you start off not caring, or was that a build-up?
No, I started off not caring.
Started off not caring
because I've been dealing with it for so long. And tried to explain it a couple times to them. They just didn't want to listen. For me, because it is a very hard thing to understand, because you can't see it, you can't touch it, you can't feel it. Nobody can visibly see panic disorder. You know, um, the you know they look at it as a way of it's just fake. What else could it be? And so no understanding comes from that.
Okay. So he's talked about his family. Most of them still don't get it, but he doesn't care. So it doesn't affect him nearly as much because he's come to the realization that, well, if you don't care, if you don't want to understand, pretty much, then fine. But let's talk about your friends, your social circles.
Okay.
Do your friends get it?
My good friends understand.
Who are your good friends?
Not you. I have a few friends that have dealt with this in the severity that I have. Actually, well, not as severe, but I've dealt with it. Dealt with mostly the same thing. Two really close friends that have dealt with mostly the same thing. One that I trust more than anybody else because he's helped me through this. You know, throughout most of my life when I was dealing with this. But then there are certain friends who want to try to fix me or claim that I want this so I can be a victim of, of what's going on, and that way I don't have to do anything and I can just sit in my disease and rot away and be happy, I guess. The way it kind of was explained, and the way I kind of took it. But a lot of them just look at it as almost in the way that the same way my family does.
Okay. Now, how does that make you feel?
I could care less.
And did you always start not caring?
They always start not caring
because it's your friends. It's
right.
People that typically, friends affect you. Depending on your culture, really. But as far as American culture, it's typically your friends that affect you a little more than your extended family. I would say.
Right. Let me rephrase that then. I don't care, but it does make me angry that if they do decide to talk about these things and try to get understanding, that a lot of my friends already think they know the answer, and yet none of them have ever come to the person who is dealing with it and ask him directly. Instead, they converse amongst themselves and try to come up with these ideas of, well, this is what I think. 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 Instead of coming to the guy who's dealing with it and asking him, well, what do you think? Well, of course I should know. I'm the one dealing with it. You don't, yet you're coming up with an idea in your head of how it is. And then that's the idea. I don't care what you say, Josh, because that's the idea.
Sometimes we think we know things. Sometimes we think we know things. Sometimes we think we know our friends, our family. But there's something going on with them. And you really want to give them advice. Above all things, you want to give them advice when you think that they're doing something wrong and they have the power to correct it. In Bob's case, he has dealt with such things, but it's an advice that is given to him that is without wisdom, without understanding. It's based on somebody else's own understanding, but not about him. And furthermore, I actually would like to ask Bob what you would tell people who have friends or family that show the symptoms, maybe not diagnosed yet, but are showing the symptoms that you have when it comes to whether or not you're showing the agoraphobic side, which is triggered by more or less panic. Um, and the panic side where you're not so much as in a place you can't control, but you're just having a random panic attack. So please again divulge what you tell the people who have a family member or have a friend who might be going through what you're going through.
The best advice that I could give somebody from looking from the outside in, don't try and put yourself in their position, because you simply cannot. You just can't do it. You'll never be able to do it. Everybody's too different for you to be able to do that. And plus, we don't like it, because to be in an experience that we're in, you know, is hard enough on its own without somebody coming up and saying, "I understand. Oh, I've dealt with this a little bit." No, you haven't. Not in the way that I have. And I'm not trying to be mean. I'm not trying to be hurtful to that person, but I'm trying to let them understand that what I'm going through is something that I would never wish on anybody. But don't come to me thinking that you know of the issue and that you can somehow sympathize with me. Because every person that's ever tried to do that with me has been wrong on every account and has done nothing for me, unfortunately. It's only made me mad.
Could you elaborate or divulge a little more on exactly what they should do?
What you can do, listen. Shut up. Don't say a word. Listen. At the end of it, don't say a word. Ask them a question. What did you mean by this? You know, do your best to do this while they're calm. Don't do this while they're having a panic attack. That's not a good idea.
Yeah, actually, go with that. Go explain how somebody should
react if
you're having one.
For me, this is for me. I usually say, "All right, no talking." You know, you can follow that rule if you want, or you don't. You don't have to, but I would appreciate it if you didn't talk. No, man, it's really weird for me. I don't. I think that's the biggest thing. Just no talking. Just complete silence. Let me talk myself out of this. Because unfortunately, my significant other has tried to talk me out of it, and she's tried her hardest to help, and it literally makes it worse. It really does, and I hate to say that, but it just makes it worse. And it triggers something that makes the panic attack worse. Because it makes me start thinking of it. Hey, how are you doing? You doing okay? No, you don't have to ask me that question. Don't ask me anything at all. So for me, during a situation like that, if I'm having a panic attack and in that moment, I'll either put on headphones myself, that way I don't have to hear anybody, and I'll put my hood on and I'll just sit back and relax, or I just ask for complete silence for however long it takes, and just write it out. And it could take A minute could take 5 minutes, but it'll go away. So that's the best advice I can give. It's just um, I understand that they want to be nice and helpful, but it doesn't work in this situation. For me, it doesn't work like that.
Please, please explain how you think it might have been a lot different you if you were if this kind of condition is known more publicly,
Mm-hmm.
is actually taught,
Mm-hmm.
as opposed to your basic flu,
Mm-hmm.
cancer, chickenpox,
Right.
and actually, now that I think about it, your basic anxiety and depression. Side note, let me say side note. Side note, depression and basic anxiety are one of the biggest disorders, psychological disorders that are talked about and that a lot of people know, and it's advocated quite a bit. But panic disorder / agoraphobia is not. And so, what you would have done differently had it been as publicly known information as depression or anxiety.
What would I have done differently? What do you mean by that?
Well, you spent years having no clue what was going on.
Right. So if I would have known right away,
More or
at the age of
less, yes.
14,
Or at least had a better idea.
what would I have done differently? Well, I probably would have seen a psychiatrist right away. Um, and then from there, got better understanding of what was going on. Had a better chance to deal with what I'm dealing with either medication or different techniques or something along those lines. I would have been uh, more educated on it, more or less. I would have known, okay, oh, wait a second, they talked about this a lot, Mom, maybe this is what's going on. Let's go find out. Then go talk to the psychiatrist about it. The process would be so much faster than me having to wait, 10 plus years to get where I'm at now. So I mean, I could be coping. I could, maybe be healed from this by now. But because we didn't know what it was, because we didn't, and unfortunately, in the family that I grew up in, you're a man, deal with it. That didn't work with me. So it would have been better. It would have been overall better.
So you see, guys, he had no clue. He's been dealing with this for years upon years. When you don't know what's going on, and you think that it's just you that's the problem, you develop a sense of worthlessness, lack of usefulness, and it could possibly lead to suicidal thoughts. In some cases, people who deal with what Bob deals with suffer in such a way that is quite different than most things you hear about. It is paralyzing from what he's described. It is something that quite literally paralyzes you, with fear of not knowing what's going to happen next, fear of what he's going through to not end, intense fear. And having knowledge beforehand helps. It helps. If he would have just known even a basic concept of what it is to have what he has. it most likely could have prevented a whole lot of heartache, of heartbreak, of suffering beyond something that most people don't even understand. And he's shaking his head at me right now. And it's just something that I want to bring awareness to all of you. That this isn't something that is a 1 in a million occurrence. It is 17% or maybe more of the U.S. population that's going on. It is something that is probably going to grow because of undiagnosis, because it's not out there. So I just encourage you to research or learn even a little bit about what's going on. Now, Bob, I thank you for your time. Everybody, I thank you for your time. Lucy is passed out beneath us, and she thanks you for your time. This is Nicholas Burkhardt and Bob saying, have a good night.
Good night.